Hello and welcome to a new episode of our podcast, Your Health. My name is Jan Klusáček and our guest today is Dr. Aleš Rod, Director of Center for Economics and Market Analyses. Welcome.
Thank you very much for the invitation. Thanks for having me.
Could you please start by telling us a few words about your organization and what it actually does?
Yeah, sure. Center for Economic Market Analyses was established in 2013. We are a research institution. We deal especially with economics of regulation. We use instruments from economics, econometrics, and other approaches for understanding the processes and impacts of changes, no matter if made by regulation or by some natural social development, I would say. Our main areas of focus are highly regulated industries.
And why is it that you felt the need to establish a new think tank, since there are so many in Czech Republic and as well as other countries in EU?
Yeah, good question. We are, I would say, rather research institution than a classical think tank. So we do not focus on like ideological or partisan stuff. We do research and analysis, and we combine, I would say, business consulting approach with academical approach, because we are academicians and we use like strictly academical methods, and that's why also many of our pop economic studies and papers are then conducted to some like academical research and papers published by the journals in Czech Republic and abroad.
So, if I understand properly, what you do is you try to provide a basis for evidence-based policies. So, and do you feel that you are being heard, or do you think that Czech politicians accept this approach, or is it more like what average Joe citizen voter wants?
Yeah, I would say that the situation is better and better, and that's why the classic approach to regulation based on the prohibitio ordinem is failing. Yeah, prohibitio ordinem means just you prohibit something and then you punish everyone who does it. And our work is based on, I would say, 4 pillars. First one is clear analysis, studies, papers. Second one is organizing events when we discuss our outcomes, conferences, roundtables, press briefing. The third one is media outreach, op-eds and comments in classical media, and the fourth one is networking and consulting, where and in all of these 4 groups is a space for providing our concepts and providing our ideas to stakeholders. And I would say it works, because when something is data-based, it's much more better than if it's I think that could work based. And politicians in Czech Republic as well as European Union are rapidly accepting this approach, I would say.
Could you give us a few examples on what you are currently working on?
Yeah, I must say that I love my work because it's very colorful. I cooperate with a great team and with real experts, as far as we are not related to a specific business. Our work is very colorful. We do energy, finance, banking, waste economy. We do health and healthcare, and all these industries. Right now, we work on like 7 or 8 projects. I would name the economic impact of deposit refund system of PET bottles and aluminum cans on municipalities in Czech Republic. We do some economic footprint studies from corporations, from finance sector and consumer goods producer. We do economic analysis of telehealth. We do impact assessment studies of land-based gambling prohibition in various cities in Czech Republic. We do also economic analysis of work-related employees' benefits. we cooperate on the project of Invisibles, in Czech Neviditelní, which is a corporate social responsibility project of Provident Financial, dealing with economically weak groups of people like single parents, seniors, students. We do a project dealing with micro and medium enterprises in Czech Republic and their competitiveness, or very interesting projects related to this data-based and evidence-based approach. And it's a CEE report about the tobacco harm reduction topic.
So we try to discuss quite a lot topics concerning harm reduction. So maybe you could somewhat elaborate on that issue.
Yeah, sure. We saw that the Czech government, in its manifesto, recognized the importance of mental health, cancer, Europe's Beating Cancer Plan at the EU level, but also health as a whole, because health is definitely one of the key topics as highlighted by COVID pandemic, but also highlighted by demographic trends and these new age diseases like diabetes, obesity, allergies, or cancer. Yeah. And the Czech government, as well as other European governments, must find the solutions which will be in accordance with fiscal pressure. Yeah. So these solutions must be smart. Yeah. And I think that this evidence-based approach into health issues and approach based on data and based on real impacts of the regulation is the most efficient way how to deal with the challenge, which is healthcare and its financing. Yeah, and we saw that the approach to risk prevention and harm reduction is very topical, as the European Commission addressing this matter in its European Beating Cancer Plan, because, as I said, everyone talks about the better regulation. It has many characteristics, but one of them is definitely evidence-based. Yeah, and evidence-based means right ex ante regulatory impact assessment, but also ex post regulatory impact assessment. Because for a long time I said that the problem of a regulation is missing ex post regulatory impact assessments, which means answer to the question: does it work? Did it work? It is in comprehension with our expectations, and that's I would say like white page in the regulatory and legislative processes in the Czech Republic. And it's like the problem is much wider, because the regulatory impact assessment is usually made by the author of the legislation, which means it's very similar like if the student of the university wrote a thesis and make the opinions report on that. Yeah.
Oh yeah. I can vouch for that, because I've from my previous jobs in consulting companies, I have quite a few of those experiences when we were tasked with exposed RIA, and then we had to just rework it several times to finalize that. Yeah, it was not so bad.
Yeah. Because I said it like many times that every regulation, every law should have several articles at the very beginning, and one of them is what is the goal, what is the approach for measuring the goal, when, how, and what will happen if the goal is not accomplished. Yeah, so that would help a lot to make a better and very efficient regulation. Yeah, because back to the prohibitio ordinem approach, the problem in tobacco economics, let's say, is, for example, that we set some goal. the goal is not accomplished, and we react on that we take the goal, add something as a cap, and said, okay, our goal is the previous one plus something, which make the goals even less realistic, and that's something which should be changed, I would say.
Yeah, several months ago, we had Jindřich Vobořil, who is new anti-drug coordinator on the government level, and he said pretty much the same. And thanks to his appointment, I feel like there is a hope for, let's say, better acceptance of evidence-based policies, at least on the national level.
Yeah, I absolutely agree with you, because in relation to addiction strategies, for many years, decision makers used this abstinence-only policies. And Jindřich Vobořil said very clearly several times that, in his opinion, scientific data and data-based policies should be like more visible, and he will make more pressure on implementing such policies in the Czech Republic, and also using the Czech presidency for addressing them to the Commission and other EU countries, which is right from my stand.
Well, you actually pretty well predicted my next question. So we discussed the national level, and what do you think about the EU, EC level? Do you think that the evidence-based policies are winning, or is it still a lot about prejudices or some political statements?
Yeah, maybe at the beginning must say that the situation right now is quite twisted by the Russian aggression on Ukraine, which means that the Czech government has taken many topics and now focus on Ukraine is pretty clear. Nobody knew a few times ago that the agenda of the Czech presidency would be so like twisted and focused on Ukraine. But apart from that, the government also focuses that the healthcare and harm reduction could be one of the topic, as I said before. And I think that it's pretty in accordance with the Minister of Health, Vlastimil Válek, who said that the roundtable organized by Zdravotnický deník, that he supports the risk prevention policy, and that he would like to see the discussion around it to become a priority of upcoming Czech presidency, which is good, because the discussions in the Czech Republic and the political statements as well must follow the best strategy, and the harm reduction is the best strategy in prevention of the negative externalities made by all addiction-based industries like tobacco, alcohol, etc. And I think that back to your question, in the member states of the European Union, there is pretty clear that the evidence-based policy is starting to play a major role. But in the Brussels, there are maybe more conservative, which is not like, I would say, which is not like bad in general, to be conservative and to ask questions more than trust blindly to someone. But in this issue, I think that the pressure of the European member states must go into Brussels and show that according to European Beating Cancer Plan or tobacco TPD, there should be some changes made.
Well, you already mentioned that the priorities are generally shifting since the Russian aggression, but do you think based on your experience, that there will still be enough importance given to the harm reduction topics, or is it all going to be just about saving Ukraine?
I hope that it will be also that our presidency will be dedicated to topics like harm reduction, because it's very important, and it's and let's say it clearly, it's a way how to find more sources for financing so many areas and financing the Ukraine and humanitarian crisis made by the war, Russian aggression is one of them. So we need to find more sources. We need to make our healthcare systems more efficient, and harm reduction is one of them. So it is necessary to put it into this perspective, that it is not like different topic, but it's complementary topic to the Ukraine and the agenda related to Ukraine, and that's why we decided to look into the policy of harm reduction and how it's applied in the CE region, specifically more broadly at the EU level. We are working on the study, which will be discussed in June, in 9th of June in Czech Republic, in Prague, will be presented. The study, tobacco harm reduction practices in CE and the EU level, should be, or could be, and we hope it would be, one of the pillar or a document for the setting the agenda of the Czech presidency related to the harm reduction.
Well, actually, I think it was again mentioned Indrigo Bořil, who stressed the fact that actually Russian oligarchy and government is deeply involved in the global drug business. So if we are implementing rational addiction policy, we are also limiting income of the bad guys, right?
Yeah. That's sure. The fact is that, of course, there's this eastern branch and eastern channels was the main channels for importing the semi-legal and illegal tobacco products in the Czech Republic and into the European Union. COVID and barriers made by COVID also changes the situation. The Czech Republic is not just the transport country or transit country, but it's a country where the contraband finished its travel, and it's in many areas, in many regions, sold by the people who try to take advantage that this stuff is not taxed properly. There is no excise tax, no VAT, so you can buy it cheaper. And the question is not just a fiscal one, but also quality one. But surely tobacco products are not good for your health, but smuggled products and illegal products made in conditions not following basic hygienic standards and the stuff are even very terrible for your health.
Let me just play on a more personal note. How does one, as a student of economics, become a research assistant, research director of a prestigious think tank?
Yeah, it's a good story, but not very difficult, because when I was a student, when professor just picked up me from the class because he said that he saw some kind of talent and analytical talent in me. It was Jiří Schwarz, my dear colleague, and I cooperated with them. I've cooperated with him since 2008. firstly at University of Economics, then in Liberal Institute, and in 2013 we together established the Center for Economic Market Analyses, and till today we cooperate. So the short answer is Jiří Schwarz, my colleague.
Right. And so what are your plans for the future for CETA? What are your next projects?
Well, I would say that we saw a very good opportunity in this harm reduction perspective, which could be used not in the tobacco industry, but also in alcohol industry, gambling industry, and all the stuff. I think that it's our competitive advantage, let's say, because we deal with that for many years, and I think that the right time to make our research more popular is coming. The next big topic from my perspective is waste economy and all these fulfilling political EU goals in the waste economy. So that's another topic. And of course, our topics are related to regulation. Politicians like regulation and new laws. So I think that the car is continuing in its travel, which means that we will have a lot of work. But to make it more personally, of course, it's good for our business. But as a taxpayer and a citizen of Czech Republic, I'm not very happy from some work we do, because it means that the situation is not very efficient, and we try somehow to make it on a better way, let's say better regulation.
Great. So good luck to you, and thank you very much for coming.
Thank you very much for inviting me, and I feel very honored to be a guest in your podcast. Thank you.
Thank you.